Yeah. I hear you. Court, you have before you the consent agenda.
Move for approval.
Second. We have a motion and a second. Please vote. Commissioner Johnson? Commissioner Johnson, you're on mute. Commissioner Fickus?
Yes.
We'll give him just another second or two.
I don't think he's on it this time. He's not available right now.
Okay, then, motion passes 4-0. Say,
Yeah.
Right on time.
motion passes unanimously.
Members of the court, if we can now go to the,
Excuse me, I've got an announcement.
I'm sorry.
Yeah. I'm going to make this brief because I've got quite a bit to cover. I'll make this quick rather. One is we are in the second day of early vote for the November election. It's important, especially if you live in precinct 2, that I want to tell you what is on your ballot, what may be on your ballot, depending on where you live. For all Texans, though, we have 8 constitutional amendments that are on the ballot. For all Tarrant County residents, we have Proposition A and Proposition B that are on the ballot. And then if you live in Mansfield ISD, you have the penny swap on your ballot. So please make sure that you make your voice heard in this election. Later on today in our agenda, I think we did it in our consent, was a rides to the election. So specifically, if you live in Precinct 2 in Arlington, you can schedule a free ride to go vote through Arlington Via or Arlington Handy Tran. There is a website that provides all the options regardless of where you live in the county. Then also, this Thursday, we will be hosting our second County Redistricting Community Input Session from 6 to 8 p.m. at Dan Diper Career and Tech Center there in East Arlington. Again, that's 6 p.m. You can come there to hear more about the county's redistricting process and to provide your public input. And then last is next Monday via Zoom, we are hosting our regular quarterly Precinct 2 update on the JPS bond. So you will hear from our 2 Precinct 2 appointees, as well as the Broadus Levis team and our Tarrant County Hospital District CEO. That is at 11 a.m. next Monday, October 25th. Please contact our office or visit the county website so that you can register to participate in that virtual meeting. And that's it.
Thank you. Anybody else have any announcements? I
We have
apologize.
tonight at 6 o'clock, I believe, a redistricting meeting at our office at 645 Grapevine Highway. Starts at, I think it's scheduled about an hour and a half, 2 hours.
6 o'clock. Yes.
Huh?
It starts at 6 o'clock, sir.
6?
Yes, sir, 6 p.m.
Well, okay, that's what I thought it said. Yep, 6 o'clock. Thank you.
Okay, there's no other announcements. Then, Mr. Manius.
Thank you, Your Honor. Members of the court, we can now go to the briefing items. We're going to go to item B first. This is the public input session as it relates to redistricting of the Commissioners Court precincts. Mr. Bob Heath is here to address the court at this time.
Thank you.
Good morning.
What we have today is a public input session And we've been having these across the county in the various precincts. As Commissioner Fick has said, we're having one in Precinct 3 this evening. There are also ones coming up in Precincts 1 and Precinct 2, and we've already had a couple before. And this is one here today at the Commissioners Court meeting. The main thing is that the 2020 census revealed that the commissioner precincts here, the ones that have been in use since 2010 or 2011, are actually in population balance. They were 10 years ago. They're actually closer to being balanced today, 10 years later. And because of that, there's no legal requirement for the Commissioner's Court to change those precincts. It may if it wants to, but there's no requirement that it do so. And a few weeks ago, when we presented this to the court, it decided it wanted to give people the opportunity to comment and go through public hearings to see what they thought about leaving the precincts as they are versus proposing changes. And so that's what's happening today and has been happening throughout the county. Here are the current commissioner precincts. I'm not going to linger on that, but they're the ones that have been in use. And here is the population breakdown. And as you see, the ideal size for a commissioner's precinct is roughly 527,000 persons. And the precincts have a total maximum deviation under the current population of less than 2%. And so that's very close to being in balance. The standard that we'd like to look at to make sure that they will meet legal muster is a 10% deviation. This is less than 2. I'm going to skip over these other charts, which are just more details of those population numbers. And here you can see the racial and ethnic breakdown in the county. Over these next 3 slides, this is the African American population. The darker the color, the greater the concentration. And largely in Precinct 1, also in Precinct 2, and some scattered population throughout. And of course, there'll be other areas that don't show up on the map because it's less than 20% of the voting precinct. And here is the Hispanic population. And again, Precinct 1, Precinct 4, and Precinct 2 is where that population is. And it's more spread out. And finally, this is the Asian population, and it is more spread out. This chart is a little different because the Asian population is not as numerous as the others. And so while that chart, the others said 0 to 20, 20 to 40, et cetera, this one is 0 to 10, 10 to 20, 20 to 30, and that way we can see the population a little better. Now, the Commissioners Court adopted criteria that we want any plan, the existing plan or any new one that they decide to do to follow. And I will just say that these criteria sometimes are in conflict with one another. You can't, maybe if you're going to have equal population, that may militate against some compactness and so forth. But basically, these are we're going to use identifiable boundaries so people can see where the precinct is and understand that that'll be streets, major highways, rivers, creeks, etc. We want to maintain communities of interest in neighborhoods to the extent possible. Again, as we have to have equal population, it may not always be possible to do that, but we want to try. We want to use whole voting precincts if possible. That helps election administration and avoids confusion. We want to base the plan on existing districts so that we don't start with a blank slate. We're going to have districts of relatively equal size. We want districts that are compact and contiguous. We want to keep existing incumbents in their district, and that's something that obviously people think about that as benefiting incumbents, but it also benefits the voters because it lets them decide who's going to be elected and who's not, and doesn't push somebody out of the district. And finally, we're going to narrowly tailor our plan to comply with the Voting Rights Act. And in order to comply with the law relating to redistricting, we've got to have equal population, relatively equal. We need to make sure that our districts don't have the purpose or effect of discriminating against racial or language minority groups. And we want to adopt districts where race is not the predominant consideration, but instead the use of race is narrowly tailored to ensure compliance with the Voting Rights Act. And that's basically the standard that the Supreme Court has set. So without further ado, I will just open it up to see if there's anybody else that has any comments. We're happy to take comments. There are also comment forms out in the lobby that you can fill out, give your name, address, and any written comment. And even if you make an oral comment, we would like you to fill one of those out so that we have a record of it.
So this is a public hearing,
Public comment, yes.
public comment area. So if anyone does wish to come forward and make a public comment, or if you don't want to make a public comment, as Bob just indicated, you can fill out a card that is outside, and you're welcome to do that, and we would very much appreciate you doing that, because we do want to give everybody an opportunity to make any comments or suggestions that you may have. So as we're considering any changes that we might make, we would be able to take those into account. Okay. Court members, anything? Okay. Thank you, Bob.
Thank you, Judge.
So members of court, if we can now go to the briefing item, it'll be item 11A. This is the current and emerging health issues. This will be something that Mr. Tenasia will be presenting to the court at this time.
Good morning, Your Honor, and members of the court.
Morning, Benny.
So we're back here after almost 2 weeks, and I come bearing good news. The trend is down for COVID. The numbers are starting to look much improved. A lot has happened, obviously, in the last 2 weeks, but we're at 357,000 and some change in the number of cases and 4,564 deaths. But the significant part is hospitalizations are trending down, our case counts are trending down, all of the indicators are in a downtrend, so that's great news. We're almost half in terms of hospitalizations where we were 2 weeks ago. So we have 456 people in the hospital confirmed with COVID. That's 10.71% of the capacity. Pediatric hospitalizations are down. 2 to 3 weeks ago, we were at like 40 some, and now we're at 15 kids in the hospital. 3.72% of pediatric bed capacity. Trauma Service Area E is down significantly. 1,568 people in the hospital. That's 9% of hospital capacity. So overall, very significant improvements over the last 2 weeks. And as you can see on the trend charts, on the left, that's the case chart, the epidemic curve. It's certainly pointing down in a sharp downtrend. Death data on the right is starting to show declines emerge. It's going to be slow because it's a lagging indicator, but we're starting to see certainly good news develop there as well. And then our virus spread rate, the R0, is below 1. It's 0.84, so that's great news. We're slowing down in our community in terms of virus spread. One thing I do want to point out, by definition, we're still at a high level of community spread. It's going to take a little bit for us to moderate. As far as a state goes, the only state that I know of currently is California. That's in moderate spread. The rest of the country is still in high spread. Now, there might be pockets, different communities that are ahead, but we'll get there eventually. I think we're heading in the right direction. So all of these indicators here are pointing lower. Our positivity rate is starting to come down. And then there's that threshold, the 10% mark. That's, if you start getting below 10%, that's great news in the community. Case counts on the right-hand side bottom corner. We're approaching the threshold to get below 100. I think we're at 179 per 100,000. So again, all improvements in the right direction. So things are starting to look fairly comfortable. Heading into Halloween, I think people can get some comfort that it's not raging out there in the community. They can try to have somewhat of an enjoyable Halloween event. Our guidance remains the same. Try to use as much precautions as you can. Put masks under your costume if you can weave those into your costume. Try not to go in large groups of people. Go individual family units, just like we did last year. Some might say that's too strict, but while this is still out there, let's be a little bit more careful. It doesn't hurt. And those that are handing out candy, try not to do individual handouts. Have little bags lined up on a table. You enjoy, wave at the kids, let them come by and pick it up. There's no need to be scared, but certainly some judicious use of, these common sense precautions, I think, still warranted. National trends, of course, the Southeast and Texas, we were engulfed very early on in this recent surge, but now it's moved on. I think the western half of the country and the Midwest is really in the grips of it, but I think it's starting to fade off in the Southeast and in Texas. So things are starting to look good here. The message remains the same. It really hasn't changed. If you're eligible for a vaccine, get vaccinated, wear a mask while there's still active surge going, and then avoid large crowds that are not necessary. So those three messages still work and seems to be, the mantra right now. Quick update on vaccines. A lot has happened in the vaccine world as well, but the fully vaccinated counts are slowly but surely improving all across, including here in Tarrant County. 1.43 million people have been fully vaccinated. That's 60% of the eligible population over 12 and 49% of the total population. So things are looking good. And then, of course, improvements in every category, race, ethnicity, age groups. Things are certainly starting to slowly come together, but, more work to be done. And then finally here, there's some updates, but one button that we added on the dashboard now that a lot of boosters are coming through, I wanted to show that there's a booster dose button. So almost 51,000 booster doses have been delivered. It's a little slower than what we had hoped, but a lot of this is because early on, the vaccine went a lot to nursing homes and long-term care facilities and healthcare workers and so forth. And we've been talking to DSHS. They have a plan to start addressing some of these long-term care facilities and nursing homes. So eventually this will all pick up as well.
Now, the Moderna and the J&J have been approved now, haven't they?
So the FDA committee has recommended a half-dose Moderna booster and a full-dose J&J booster, but the final approval is expected through ACIP and CDC by the end of this week. After that, they will be eligible to be distributed to the public. So final approvals are going to be, we're expecting later on this week. I think Thursday is when ACIP meets, and usually CDC makes the recommendation the same evening. So we'll find out. And then the key here is Moderna third booster is 6 months from your second dose, and it's a half-dose booster. Again, I think we talked about Pfizer having 30 micrograms in each dose. So they didn't have that dose. So it was 30, 30, 30, you get 90 micrograms. Moderna already had 100 micrograms in each dose. So it's 100 plus 100, and now a 50 6 months later. So it's a half-dose booster. Johnson & Johnson, they said it's a single-dose vaccine, but now the booster is authorized at 2 months after that single dose. Yes, sir.
Is there any concern about those that might have gotten a Moderna booster before this half dose and got a whole dose?
So the ones that are approved currently for that, sir, are people that might have immunocompromising conditions, and that one is what is called an additional dose. I know it's very confusing, but those folks can get a full dose of Moderna booster, the additional dose, because they have conditions that make them immunocompromised, so they need that little extra dose to keep that immune system going. So that is absolutely okay. trust me, even in public health circles, we've been telling, feedback to the CDC, this is very confusing for us to even explain and keep straight. But we'll try to make it as simple as possible on the website with charts and graphs. But easiest way is just to come to the sites, get vaccinated. This is more for our teams to worry about what dose to give people. People just need to know they're eligible for their booster dose and they can come.
The back and forth on the, do you mix and match or whatever, where are you on that?
So officially, they have not yet authorized. They've said we need more data. But media coverage has been anticipated anytime soon that they will come out and say, yes, mixing and matching is allowed. So far, officially, it's not allowed. What they have said in the past, especially for the one situation that Commissioner Fickus was mentioning, those that are immunocompromised, there was such a worry that they're going to get caught up in the Delta surge. Let's say they went to get in a Pfizer and it wasn't available. Go get a Moderna, no problem. As long as it's mRNA vaccine, you can mix and match. But it was very limited situations, not to be commonly used, only when the other vaccine's not available. So it's happening in some places, but generally, officially, they have not yet approved it.
So Vinny,
Yes,
I
ma'am.
heard everything you just said,
Very
but I
confusing.
want to make sure I understand. So like on Saturday, we're hosting a drive-through vaccine clinic, right?
Yes.
And we said that boosters are available, but which boosters are going to be available? And I know that your team is partnering with us, so thank you for
So
that. But
currently, officially only the Pfizer booster is available.
Pfizer, okay.
But by Saturday, we're really hoping that the ACIP and CDC would have finalized the recommendations.
Okay.
Our doctors are watching those as well, so they'll update the medical orders, and we should be ready if everything comes on a timely
okay,
fashion.
but so for our promotion purposes, just say the
Boosters will be
Pfizer-
available.
Okay, boosters available. Okay, very good. Okay,
Because we'll
and
give
that
them
is-
the right booster.
And that's from 10 to 2 at the Tarrant County Southeast Annex, located in downtown Arlington. For
Yes,
everyone.
ma'am.
So,
Yes, ma'am.
okay, thank you, Vinny.
And then, again, like I said, we're waiting on ACIP and CDC approvals. Last time when they went through this Pfizer process, we got 4 different recommendations, and the ultimate say is with the CDC, so we'll wait for that final approval, and we'll see what comes out. One final comment on vaccine updates different than COVID. The county is launching an expanded flu vaccine access program. You all saw an item on the consent agenda, but we are partnering with some local pharmacies, and I think it's going to be a 2-part deal. A couple of pharmacies were able to get their agreements to us this week, and another couple maybe coming next week. But today, we have approvals to work with Albertson, Tom Thumb, and Berkshire, which they don't have a whole lot of locations in Tarrant County, but that is approved. It is a expanded flu vaccine access program for the uninsured. So if people go into a pharmacy, one of those participating pharmacies, and they do not have insurance, they can still get vaccinated. The county will pick up that cost on the back end with the pharmacy under our arrangement. We did something similar last year. It was well received, even though the participation was sort of mild. But we're starting a little bit earlier this season, knowing that flu is coming in a little heavy this year. So we want people to have no barriers and participate in getting flu vaccinations. Additionally, last year, for the first time, CDC's Adult Safety Net program had given local health departments and state health departments flu vaccine under that program. It was a one-time deal. Well, this year, again, they've decided, well, given that the pandemic's still going on and hospitals are overloaded and so forth, we will bring that program back. So sometimes here, mid to late October, we will receive that Adult Safety Net flu vaccine also. So the health departments will also have similar vaccine to provide to uninsured. So just wanted to make sure that's available, and people are aware that an expanded flu access program is available in the county.
So Vinny, I can't remember from the agreement, what's the effective date? So when can people start showing up for right now at Brookshire's and Albertsons?
So we will post that on our website. Officially, the agreement is approved today, so technically they can, but I want to make sure the pharmacy partners are ready, because they were waiting for the signed contract. So we will put that on our website. We'll have a page about it, and I'll try to make sure all of you are aware if we know from the pharmacy partners if they want a particular date. But I know in the conversations, the Tom Thumbs and Albertson people were really excited about this because they were getting calls from the public. Hey, you had a program last year from the county. What happened this year? So we'll hopefully soon.
Okay, great, thank you.
I will tell you that the pharmacies are very excited about this. It really helps them because it used to be they advertised free vaccines, but it was if you had insurance. Now they don't have to worry about that anymore. And the pharmacists that I've spoken with, they're really appreciative of the county stepping up and doing this again. And so we look forward to that relationship that we have with the pharmaceutical, or the pharmacies in the major food markets.
Do we have an idea of how many pharmacies we're gonna be?
I'll have to go look. I'm asking them for locations that are participating because not all of their locations are going to be participating. I know that the bigger group is going to be probably coming next week because we're expecting Kroger and Walgreens. This one's a kind of a lighter group with Taunton, Radisson having more. I think Brookshire has like only one location in Tarrant County,
Yeah,
but
like
that's okay.
7.
I think the one they have is in Azle.
CVS,
CVS unfortunately did not participate last year. We didn't have them on the calls. They didn't come. And Walmart also, they declined. They have their own programs and things that they run, so they did not participate.
Tom Thumb, Albertsons, Kroger's, they're all in this program.
Yes, sir.
That's pretty good coverage.
Yes, and again, we're open to working with any partner pharmacy. Again, you know, with the flu season upon us, we just want to make sure that it's out there and at least some coverage is there for the public. And of course, health department's always there, but we wanted to make sure more locations are there. Okay, testing operations. So it's kind of good news that testing demand and volume is down, but it also presents a operational challenge for us because we now have a lot of sites out there that are providing testing, but the numbers are starting to look pretty low. Most of the locations are bringing 20, 30 samples a day. So we're starting to, this week is sort of our last week of expanded testing. In fact, in the Northwest at the Precinct 4 sub-courthouse, we did a Monday, Wednesday, Friday schedule just to make sure that our schedule was not a roadblock of any kind to get people tested, but there wasn't a lot of demand. So Monday was like 2 people showed up for testing. You know, that was pretty low. So this week is the last week we're doing this expanded testing, and then starting this weekend, we're gonna bring each location down to 1 day a week, just to make sure we can consolidate the need for testing. Now, we'll schedule it such a way that at least one public testing site is open on a given day. So it'll be like Mondays one side, Tuesdays another side, and so forth, and we'll try to cover weekend days and longer hours. But I just wanted you to be aware, for now, we're gonna scale this down. And if the need emerges again, we'll expand that up. And we'll keep watching the data. If the numbers really crater, we may have to shut down some locations in the next 2-3 weeks, but we'll bring that back to court and discuss that before we move to that. And the updated schedule will be posted on our tarrantcounty.com/COVID testing website. So starting this weekend, people will have, again, 6 locations, but limited number of days. That's it. Any questions on any of that? All right.
Benny.
Thank
Sorry
you.
for that interruption.
No, you're fine. Thank you.
Members of the Court, we can go to the administrator section now. On item A1, we're requesting that you receive and file the county's weekly overview of the COVID-19 Recovery Act report.
Move approval.
Second.
have a motion second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Members of the Court, on item number 2, we're requesting that the court approve a letter of engagement between the county and Deloitte & Touche to serve as the county's outside auditor for the fiscal year which ends September 30th, 2021.
Move for approval.
Second.
We have a motion second. Any discussion?
And what year of engagement with Deloitte?
This is our second audit year.
Second audit?
Yes, sir.
Okay.
Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Okay, I'm going to ask Mr. Schaffner to present item number 3.
Thank you, Mr. Manias. Judge, Commissioners, this morning staff is here to outlined for you all the current fiscal recovery funds, or the state and local fiscal recovery fund budgeted plan for the Commissioners Court, for how you all, from the direction that we previously received and the recommendations of our FRF work group, how one particular way that these funds can be budgeted for the next year and for the program lifespan. With the fiscal recovery funds, and again, these are the funds that were authorized under the American Rescue Plan Act of this year that President Biden signed into law. They coincide also with another item that we have to kind of bring to you together. There are two pieces of the puzzle as we're looking at our recovery plan funds. This one is also the coronavirus relief funds, the CRF funds authorized in March of 2020 under the CARES Act. So the CRF funds, again, under the CARES Act, expire on December 31st of 2021. That's December 31st of this year. And so staff is seeking Commissioners Court approval of a plan to close out our CRF grant program. So that's the part A of what we're looking for. In order to accomplish that and to be able to spend down the remaining of our funds and use it towards eligible expenditures that the county has already incurred, staff would recommend that that Commissioners Court direct staff to apply any remaining CRF funds towards presumed salaries. So again, that's under A over here, which is the closeout of the Coronavirus Relief Fund grant monies. The second part of it is that we currently have some projects and positions that are being pulled out of the coronavirus relief funding, that we need to then take those projects, positions, and programs and shift them over to the county's fiscal recovery funds, the FRF funding through ARPA. And those particular items, there's a significant amount, I believe it's about $12.5 million annualized and program budgeted. Some of that's an annual amount, others are program life. That we are seeking, again, court to remove those from CRF, put those over in the fiscal recovery fund bucket, and authorize those positions and programs out of there. And then through action that court has done and direction given to staff starting on August the 3rd of this year and moving forward, you'll see on the two green columns on your document, on your very large spreadsheet. One's the programs that are authorized. Again, those are programs that we have received from direction from Commissioners Court or you all have explicitly authorized. And the other one are the FRF work group recommendations. Those are items that departments and folks internal to the county have requested funding for, have gone before our work group to make sure that they do meet recommendations, as well as budget, admin, and others work through whether or not they're justified as actually being needed and necessary. And then you'll see within that column. So ultimately, we are seeking court to approve the FRF work group recommendations to go into the authorized program column, and then for you all to vote to move forward as a budgeted amount, not specifically line item, but as budgeted programs, those items under that program's authorized column. So those are the two specific actions that we're looking for. I know there are a lot of machinations in both of those, but those are the two items that staff is looking for today.
So when you say budgeted programs, you're talking about authorizing specific categories of activities associated with dollar amounts for later development of specific programs under those categories.
Yes, sir. Such as the first item, the capital, if we could take it for an example. This would authorize us, staff, to start working to develop out those capital projects that have been identified that was presented to before court on August the 3rd. So we would start developing those out, and they would come back to Commissioners Court as through the normal agenda process as an item under purchasing to go forward with HVAC units, for an example, or another, or a particular contract for someone. So it will be coming back to court. This is just giving us the authorization to move forward.
You know, I think one of the concerns that I have is, for example, if we authorize, that doesn't mean it's necessarily, and maybe this is the second part of that, so that I can be sure that I understand when we move. Because once we've authorized something, that says you can do it. And from this point forward, I'm gonna have to say to you, I'm confused. And you and I talked about this yesterday.
Yes, sir.
Because we talk about the fact that we still have CARES money left. And as I told you yesterday, I was under the impression that we had done everything we could to allocate all the CARES money through 2020. And I thought that between 2020 and December of 2020, we were told that CARES money's been taken care of and we don't have to worry about it. And yet we've got almost 14 million related to CARES money in this. And so, and I also have talked about, and I'm looking for Helen, as well as the auditor's office, of saying that I wanted us to identify money that we were able to
Apply to eligible expenditures.
apply, no, not to eligible expenditures, apply to any expenditures we want. We took CARES money, we applied it to eligible, which freed up money that then, when we decided we wanted to do rental assistance or business grants, and the auditor, rightly so, was not sure that it could be tied directly to COVID, therefore we couldn't spend CARES money on it. This money would be eligible to be spent on those type of programs. So, that went from, yesterday we were saying, well, we still had 30 million of CARES money that we needed to do something with. And so I'm confused from that standpoint. Also, we authorize something and then sometimes the actual move forward appears on the consent agenda. So at this point in time, I would like to ask from this point forward that we don't put expenditures of CARES money or ARPA money on the consent agenda. I would like for there to be an item, and it could be, here's all the CARES money we're spending today, and we want you to authorize it, but it's none of it on the consent agenda, and the same with ARPA money. Because I would like for us to be able to be a little bit more careful when we're actually authorizing the expenditure. And, I mean, for example, if you look at the FRF work group recommendations, that first item there says additional space for Tarrant County Medical Examiner. You and I talked about this yesterday because I brought up the question.
Yes, sir.
What would you believe that we're doing with that?
Additional
I've been
space.
told that it is space to deal with the trucks that they have out there.
I think it's leasing the coal trucks, refrigerated trucks. Well, there's just things like that that I feel like I just need to better understand.
So may I comment?
Sure.
First of all, if you would like, or any court member would like, for us to make sure that we don't put anything on consent as it relates to those type of expenditures, and mark that on the agenda so that everybody is very clear what we're voting on, we can make that happen. There's no,
I'd like for that to happen.
okay, so,
And what's important to mention on that part is that's not what we originally agreed to do. So we originally agreed that it was gonna go on consent. That was my memory of conversations months ago. So we are changing course. So because I know that there was some confusion, but I always understood that we were going to see some of these things implemented as consent items.
so we.
Now we're saying that we're not gonna do that, which I'm
Well-
fine, I'm fine either way with it. but-
And it's, whatever any individual court member would like on that, so.
That's what I'd like.
Second of all, we have enough expenditures that we can apply the CARES Act funds to, okay? And so we don't have this extra surplus. But if we apply, if we move the CARES Act, or if we fund those things, it frees up cash. And we have in this current budget, 2022, we have a contingent revenue of, I think, $20 million, which will fill that bucket. And it will then get to the point, Judge, that you will have those extra revenues that you are asking about that technically do not have any strings on them. And you can expend those, whatever the legitimate expenditure that a county can make for those monies.
Well, and what I hope that we have is a very good accounting of the money that is in that bucket. Now, right now, that bucket may be in cash carry forward. It is in cash carry forward, but I want to be sure that we have distinguished what's in that bucket and that it's not just grown in.
So with this $20 million anticipated revenues, there's an offsetting anticipated expenditures, and they have not been identified. But they will be some, it's kind of like our contingency.
Understand.
And so that gives the Commissioners Court the flexibility to spend those dollars the way you would like to have them spent. I honestly believe that that is a good move to make, because first of all, it answers the question and allows the auditor and budget in our office to close out CARES, okay? Because that has to happen by the end of this year. It frees up the type of money that you're talking about, Judge, which creates greater flexibility to the Commissioners Court on different ways. That the only caveat you'd have on expending those funds is that it has to be for an expenditure that a county has the authority to make. And everything that we've talked about, you have that authority, okay? So it accomplishes what I believe that the team would like to accomplish, and at the same time, give the court the flexibility that you need if you want to make those type of expenditures.
And yesterday, I think you were saying that we had somewhere in the neighborhood of 30 million CARES dollars left?
Yes, sir. There's somewhere, depending on how the POs shake out, if Commissioners Court give us the authority to close out CARES, depending on how some of those POs are closed out, it should come in somewhere around 30 million, give or take.
I thought that what you just said is that, I mean, for all intents and purposes, we have spent, as of the end of last year, December of last year, we could have spent all of our CARES money.
We had eligible expenditures
Yes,
that we
sir.
could apply the CARES fund to.
Okay. So what I'm saying is I don't want us to come in here and approve something because you tell us that we've got to spend the 30 million when we could have already spent, we could and have already spent the 30 million or spent everything that we had left in CARES in the current, or the fiscal year that ended September the 30th. So that's one thing. And then I think the other thing that we had asked for and have been asking for is the fact that 2 or 3 weeks ago, we talked about the fact that we had authorized the expenditure of over $100 million. And as I recall, most of us didn't realize that that had actually been done. And that's what I'm saying is I want to be sure that we know when we're authorizing and what we're authorizing it for. And especially now, today we're going to get the interim report for our needs survey, but you know, and I know there are certain things that we needed to and have spent thus far, but I'm glad that we're getting our needs survey today and that we can begin to maybe, if we agree with what the needs survey says, then begin to make sure that what we're spending money on agrees with what that says. So,
Bottom line, let's spend the CARES Act dollars first. Let's make sure that we spend them all by December 30th. And let's keep a very close accounting and make sure that the court is
So it's-
keenly aware of the expenditures and the balances under ARPA funding.
Absolutely. Yes, sir.
I personally think that the strategy that the team has laid out, and as you move not only for action today, but in the future, is the best strategy that you can utilize, and it gives you the greatest flexibility that you want.
And one of the questions that I had posed in previous weeks, and I will do it again today, is we've got a lot of stuff in capital, and I know you've outlined to us, you've given us an outline of the capital. And some of that, you know, we've authorized it, so it can be spent, but I'm not so sure that I realized that some of this stuff wouldn't be more routine, and instead of spending our ARPA funds for that, I'd rather that have been spent in our regular routine type budgets. And that took me back to asking for the last master plan that we had, and, you know, I don't know when that was, I think it was a 10-year plan. And I don't know when it was, and I don't know what it looked like, and I don't know what progress we're making, because we're now authorizing a 20-year plan, and I'd like to get a better idea for, you know, what's happened to the 10-year.
What's left, yeah.
Yeah, where are we, and we make plans, but if we're not really moving on and following up, then I don't know that it's necessary for us to spend so much money obligating, or it obviously doesn't obligate us, that's the whole thing, is that we're spending money for a 20-year plan when maybe the 10-year plan will still go out far enough to accomplish what we need.
Understood.
And I don't know if that means we need, am I correct that if we've authorized a program, then everybody can proceed and spend the money because we've said it was authorized?
No.
Sir, so how we're understanding, let's make sure that court and staff have like understandings on this particular item. So such as the facility space study, I believe it has been that RFP has been out. I do believe they have responses back in. Yes. And so it will be coming back to court to award a vendor for that space study based on the RFP. So that's a process that, again, it will come back to court. This is allowing us to begin the process to go through to actually get the RFPs out there, the RFQs, develop those strategies and work this forward to where we can bring something actually back to court for specific action where you're obligating funds and committing dollars.
Just authorizing the direction to head into.
Yes, sir. Yes, ma'am. Yes, ma'am.
It's more akin to setting up a budget and then approving expenditure items at this court as they occur under that budget.
And I'm okay with that, except that usually when we go to the RFP process, we've pretty well decided that once it comes back and there's a recommendation, we're gonna approve that. And so so this could end up being an exception. That's why I would like to see the 10-year plan or the last plan. It may not be a 10-year. It may have been a 5-year, and it may have been 10 years ago. I would just like to see the last plan that we had, get an update on that, and then before I determine that I want to spend money to do a 20-year plan, if we still have 9 years left on the 10-year plan.
So we can get that plan up to the court. What it does give you the opportunity to do is move forward with the RFP, bring that to court, and then several decisions could be made at that time. First of all, the funding source as to where you're going to fund it. You can either, you'll still have the ability to have this discussion that you're having now. And prior to that, you'll see the if it is a 20-year plan. I thought it was a 10-year plan, but we'll go back and check. You'll see that, and you can have discussion, because there's been times when we've done RFPs or RFQs where at the point of either approving or not approving those, we simply didn't take any action at all. But we can't get to that point until we get to this process.
And just to piggyback on Mr. Manius's comment, with the desire for there to be no consent items, that means that requests to take bids or to go out on RFPs won't be on consent for ARPA-related items. It'll be something that you all will have to take a specific action on before we go out to bid.
And
So just to be very clear that.
That's what I'm looking for, but what I'm looking for is maybe one agenda item that says, here are the CARES Act, or here are the ARPA projects that we're gonna right now suggest that they be paid for with ARPA funds. And it gives me a chance to at least say, no, I think that ought to be paid for out of the normal budget, and that may influence where we end up doing it.
So we can set the agenda to make sure, we'll put them all, what we'll probably do is put them all under the administrator section, and that way you'll capture it there, and we'll make sure that it's clearly defined in the agenda itself, that where the funding source is.
So, and for the action that staff is currently coming to Commissioners Court regarding, again, 2 steps. First off, regarding the CRF funding, that we would close out the CRF funding as of October 31st, to where we would, all requisitions and POs would go away, and then we would take those funds, whatever is left over, and apply them to the presumed payroll expenditures, presumed salary expenditures that are eligible, and go ahead and move forward with that. So that's part A. And Ms. Tidwell has been.
What's part B?
Then part B will be to move over the FRF recommendations, work group recommendations, to the programs budgeted. Maybe we don't say authorized anymore. Maybe we say budgeted on the spreadsheet, just to clear, clearly wording, to move those over to the budgeted list, and then have the court approve the budgeted list at this time.
And is that your request to the
That
court?
is that would be my request for approval.
Can we do both of those with one motion?
Yes, you may.
I move approval of the recommendations.
Second.
We have a motion and a second. With regards to the FRF recommendations that you're moving over, what was the co-file again?
The Helen, I'll let Helen address that one specifically. She worked on that.
That's to give the district clerk the ability to put items online so that the defense attorneys or anyone requesting the information can seek it online instead of coming into the office, having face-to-face interaction with the clerks at that time. Currently,
But don't they pay for that with a subscriber's fee?
I don't know the answer to that. I don't know if this would be part that he would be making available to them, or would that, I was looking for somebody from the district clerk's office here.
He's probably back there eating cookies.
I will go search him down,
Because-
because I don't know the answer to that.
Go ahead.
I have a question on the translation services, if you just elaborate on that.
Well, the translation services are for rental and different ads that are being put out to be in various languages.
So basically, it's just like at a, on an ad hoc basis? Okay.
That's correct. We have a contract with that service now, and so it would be utilizing it for those specific needs, not in general, but just those specific needs. Any sign that needs to be translated into multiple languages, any ad that needs to be translated into multiple languages.
Okay. So when will we get to the point to where we are dedicating more resources to what we clearly see that we're gonna need, regardless if there's the pandemic or not? And obviously, I know that this is specific to the uses for FRF, but it speaks to a larger issue that I have been a broken record about since day one. So I just wanna make sure that if it's $25,000 now, I mean, it's going to be an ongoing need, and we may need to look towards a long-term solution.
Yes.
Okay.
Well, a couple of things. There's a lot of personnel in here, and in every one of these instances, when we talk about personnel, we're talking about positions that everybody understands that when this is over with, those positions go away.
Yes, sir.
So I want to I mean, I'd almost like for the department heads to sign something that says they understand that if they've got a position that's created in this, that come December 31st, 2024, that position is gone.
Actually, we treat them as grant positions, so that when the funding ends, but I would like to address that because quite frankly, I had a concern about that also. And so each one of those positions and each one of the programs, they have KPIs that are assigned to those individuals. They have to, and the work has to be directly related to COVID. And second of all, they have to show that they're actually producing. And that, key performance indicator, or KPI. And I think we're going to evaluate that on an annual basis.
Yes, sir.
Not a 4-year basis, but on an annual basis. And you'll see these coming back to you on an annual basis for funding.
Good.
Okay, I think that's, the other one I had in it, Chief, it was the 20 bailiffs. And is the intent there to take bailiffs in current courts and move them over to help you out in other areas and put these bailiffs into the courts? Because they may not be certified jailers or.
The bailiffs that we're talking about there, those employees are actually commissioned peace officers that are working for other jurisdictions that we're bringing in. We're using them supplementally in our staff to free up some of our staff to reassign. In other words, if we have a 3-position post, we could use one of those bailiffs to assist there and then free up an experienced judicial officer to go work in a court.
Okay,
So that's the purpose of that.
okay, thank you.
Think of it as a part-time engagement.
Okay,
Relief fund.
any other discussion?
Yeah, I'm kind of frustrated because I feel like we're having the same conversations over and over again. You all provide us a lot of information, right? And sometimes it's in context, sometimes it's out of context, and we've got to put it together. And I think that you all have been as helpful as you know to be based off of the direction that we've given you this week versus the next week versus the subsequent weeks. So I don't know what more, well, maybe there's nothing else that needs to be done. I guess here's my question, is what do you all need from us to make sure that you're not sent in a direction that you're then asked to very little time after you spent so much time going in one direction to pivot and go another, which with this whole pandemic thing, we've all learned how to pivot. But it just seems like there's a way to simplify this so there's a little less confusion and we won't spend so much time repeating some of the stuff that we've talked about. Does that make sense?
And here's the answer to that. We need a formal commissioner's court order to give us direction that we're seeking.
So
And-
what we're doing today should help to clear things up moving
Absolutely,
forward.
absolutely.
Okay. Anything else?
That
Okay.
this will be sufficient
All
at this
right.
time. Thank you, ma'am.
If there's no other discussion, please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you all very much.
Members of the court, if we can go to item number 4, Mr. Merritt is going to be presenting this particular item.
Good morning, court members. We have before you an agreement for approval between Tarrant County and MHMR of Tarrant County to operate the Tarrant County Mental Health Jail Diversion Center.
I will move approval of the agreement, but I'd like to take note of a couple of things.
Yes, sir.
Number one is that the advisory committee that we have considered since the inception of our talks about this is not in the interlocal agreement, and I'm not sure that it needs to be in the agreement itself. But I don't want to see it get swept aside because it's not in the agreement.
Yes, sir.
I would like a reconfirmation of the court that that is what we expect to happen as part of the operation of the Mental Health Diversion Center.
I'll second the motion and second that comment from the standpoint that I think it's, you know, the interlocal agreements between MHR and Tarrant County. But that advisory committee is one that is gonna be critical to the success, because that means that everybody who is utilizing the facility, the police, the sheriff's office, whoever else, you know, Lauren King with the homeless folks, all of them will have the ability on a regular basis to get together and to discuss those things that are going well and those things that are, you know, are in need of improvement. So
Yes, sir.
I agree with you, Commissioner, 100%.
We intend to bring that committee back to court for approval within the next several weeks.
Okay. The second thing is that this facility will present us with the ability to do various kinds of research. And one of the things that occurs to me is research on health disparities among the population that is served at this center. And I would like to make sure that the ability to do that is fully included in our understanding of how we're going to run this center.
Yes, sir. In number 8, actually, we have several performance measurement and regular reporting requirements on MHMR to assist in that endeavor.
All right. Go.
Well, and I'm totally supportive of this. I'll ask that when we get the update in a few weeks from the advisory council, that also we're briefed on the law enforcement component of it. If there's anything that I've been asked the most about the status of this program, it's, well, what about the law enforcement component? And I think that the CDA had given some updates. This would have been months ago,
Yes,
when it was still very much of a concept. But now that we have formalized it, just want to make sure that everyone's clear on the moving parts. And I'm sure Commissioner Brooks and the judge, because they've been so central to moving this forward, are up to date, but I'm not. So
Yes,
I'd like to be.
Understood.
Any other discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you.
Then finally, members of the court, on item number 5, we're requesting that the court repeal the prohibition against outside burning in Tarrant County unincorporated areas.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you, Your Honor.
When do we want to break for lunch?
We can break it anytime. You can take the auditor's office real quick and then break.
Okay. Ms. Tidwell?
Good afternoon.
Hello, good afternoon. We have several items that we're asking the court to consider today. The first is the approval and release of depository collateral and $14,001,000
Move
is
for approval.
outlined.
Move for approval.
We
Second.
have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Next, we're going to ask the court to receive and file the Tarrant County financial statements for the months ended 2021 August.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
We're next asking the court to receive and file the auditor's report related to the Domestic Relations Office, and you have their response attached.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
We're asking the court to receive and file the auditor's report and the review of the financial and system controls of Justice of the Peace Precinct 6 and their response.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
And finally, we're asking the court to receive and file the auditor's report for the Tarrant County Sheriff's Commissary operations for FY 2020, and you have their response attached.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Thank you, Ms. Tidwell.
So, Your Honor, if we would like to go into closed session at this time.
Okay, then at this time, we will we'll recess our open meeting and proceed to close, discuss items exempted under section 551.071, 072, 074, 076, and 087, and 0725. They're all ready if y'all want to. Can y'all work while y'all doing this, or you have to? Everything's signed.
Down today, but
I may ask you to.
oh my gosh.
I bought that at 53.
Yeah. Wow.
You ready?
So, Your Honor, we could now go to Human Resources.
Move to receive and file a personnel agenda.
Second?
We have a motion and a second to receive and file personnel agenda. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you. We have a few more items for the court. The next two items are requests for extensions of project employment. The first request comes from Archives. The request is for an additional year of project employment for an employee who's working on their digitizing project. If approved, this additional leave would expire November 5th of 2022. We're looking at, if approved, we're looking at a cost to the general fund of approximately $75,282 and some change.
This is Roy's favorite one.
Yeah, I thought we were getting out of this
I was
business.
hoping we wouldn't have to have this discussion today, but.
Yeah, I know.
I know. So there is not a full-time position currently, Commissioner, to move this employee into. I believe that is currently a discussion that's underway, but there is not currently a full-time position.
Okay.
Move for approval.
Go ahead, figures you can be on the team.
I'll be on the team. I'll second that motion. I'll second that motion for us.
Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
I hope y'all give Melissa a hard time when she's up here after me. We'll
Well,
see.
that was a little inside joke.
Okay. So the next item is a request for extension of project employment. As I mentioned earlier, this time from Probate Court 1. Judge Ponder has a temp who will have worked the 2 years that the policy allows, plus an additional year as of the 28th of this month. So the request that you have before you is just a few more weeks of an extension, specifically through November 12th. And what that will do is that will allow this individual to actually apply for a full-time position that was included in the 2022 budget. So that'll just give them a little bit of time to work through that process. We're estimating a cost to the general fund and probate contribution fund of approximately $3,300.
Move approval.
Second.
We have a motion and a second. I would just note that Melissa came in, so that she must have heard what you said.
Okay.
And so,
Yeah, she knows she's in trouble now.
Get ready, Melissa.
no further discussion, please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
So the next 2 items are TO changes. The first would affect both budget and risk management. Budget, risk management, and the county administrator's office. So the request is for a transfer as well as a funding change for 3 data analyst positions that are currently in the county administrator's office. The request is to transfer those to budget. And also to move funding from ERAP funding to ARPA funding. If the court agrees, then we'd be looking at an impact to ARPA funds of approximately $196,558 and some change.
Move for approval.
Second.
We have a motion and a second. ERAP, is that?
That's the Emergency Rental
It's a new
Assistance
county.
Program.
Well,
It's gonna be a long day, Judge.
I got that look.
It's after lunch.
So
Your mic,
ERAP is the Emergency Rental Assistance Program.
which was paid for out of the CARES Act money?
It was not, no. This one was paid out of a grant from HUD. Remember, we received Treasury, I'm sorry, Treasury. And so why don't you explain?
You have to come up here then.
The county administrator just delegated.
I am delegating certain
All right.
responsibilities.
It was
So
so much
our-
easier if you'd have believed me.
I'll be quick.
The new county.
Our ERAP program is funded through the ERA grant through Treasury. We originally came to court and asked for 3 data analyst positions for this program. We are not going to use those positions because we identified other existing positions. So budget has a need for 2 data analysts, so we're asking to move 2 of the 3 approved for the Emergency Rental Assistance Program to the Budget and Risk Management Office to work on ARPA.
So we're not moving the rental program over to the budget, we're just moving the people over there, and that other program's going
To stay this.
someplace else.
The other program is going to stay exactly the way it is now. We just don't need those positions for it.
Good idea. Any other discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
So I think we are on item 5. This again is a TO change for the county courts of law, number 1, and the sheriff's office. So as described in your court communique, the County Court of Law is requesting an auxiliary court coordinator. They want this position to assist all three courts with the backlog of forcible detainer appeals received from the JPs. The second position, the Sheriff's Office, is requesting an HR coordinator position to help with COVID-related leave requests. Again, both would be ARPA funded if approved by the court at a cost of $161,49 and some change.
Move for approval.
Second with a question. Is County Court of Law number 1 the main court where these appeals on forcibles are heard?
It's my understanding that this position will reside in one, but will actually assist all three courts with the appeals.
Okay, thank you.
You're welcome.
No further discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you. And our sixth and final item, we're asking the court to approve a double fill as well as a waiver for the 141st District Court. This is Judge Chupp. He is a court coordinator who's retiring December 1st, and the judge is requesting a waiver of 320 vacation hours as well as a double fill from November 8th through the 30th so that the appropriate cross-training can occur. We're looking at a cost to the general fund, if approved, of about $16,178.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
And Judge, if I could take just 1 minute to make an important announcement for all of our employees. We are at that time of the year. We're getting really close to benefits enrollment for next year. All of you should have either gotten your packets or you should be receiving your packets soon. I received mine in the mail over the weekend. Just a couple of important reminders. Enrollment will begin October the 28th and will run through November 10th. So it's going to be really important to make any elections that you'd like to make for next year. Remember, elections don't roll over, specifically your flexible spending account elections. If you want to put something in your own account, that does not roll from year to year. So whatever you want in place for yourself and your dependents in the way of benefits for next year, make sure that you get your elections in by the deadline. Again, that's November 10th. There will be a webinar that the Payroll and Benefits Service Center will be hosting on the 27th of this month at 10 o'clock. You do have to pre-register for the webinar, and so check your email. You should have an email from PBSC. So take action. Thank you. Melissa, they're going to be nice to you.
Thank you, Tina.
We'll be making promises. Good afternoon.
Good afternoon. We have 10 items for your consideration. The first item is an award recommendation for bid number 2021-113. This is our annual contract for lawn maintenance for facilities management, awarding to the primary, secondary, and alternate vendors listed in the court communique per unit price.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
The second item is an award recommendation regarding bid number 2021-117. This is for trench drain concrete repair projects for facilities management, awarding to Gibson and Associates in the amount of $75,000. If approved, we're also requesting contract approval and acceptance of the payment bond.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
The third item is an award recommendation regarding RFP number 2021-127. This is an in-building radio coverage enhancement for Mansfield Sub Courthouse and Lionel E. Cooper Community Justice Center for the Information Technology Department, awarding to AWS Communications in the amount of $96,626.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
The fourth item is also an award recommendation regarding bid number 2021-129, annual contract for HVAC, chiller maintenance, repair, and parts replacement for facilities management, awarding to the primary, secondary, and alternate vendors by section, per unit price, per hourly rate, and markups for parts.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
The fifth item is an award recommendation regarding RFP number 2021-146. This is an annual contract for counseling and education services for a Veterans Treatment Program for Criminal Courts Administration, awarding to the primary vendors listed in your court communique by section per contract terms.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
The sixth item is an award recommendation regarding RFP number 2021-154. This is an annual contract for temporary personnel for event response data analysis for public health, awarding to the primary vendors listed in the court communique per contract terms.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
The seventh item is an award recommendation regarding bid number 2022-002. This is our annual contract for exterminating, pest control, and bee removal services for facilities management, awarding to pest-proof exterminating services per unit price and per hourly rate.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
The eighth item is a recommendation to cancel an award to B&T Besto, doing business as Milner Wrecker, regarding bid number 2019-035. This is our annual contract for wrecker services, and award to the recommended next low bidders. This vendor cannot comply with the 1 hour response time, so he asked if he could exercise his 30-day out clause.
Move for approval.
Second.
We have a motion and a second. Any discussion?
Are we doing this without penalty?
He asked to be removed because he didn't want to demolish his reputation with the county. He has done business with us before, but his letter stated that he just couldn't manage the 1 hour wait time, and he didn't want to continue to have officers wait over an hour for his services. But because there were complaints and he didn't want his company tainted, he just asked if he could exercise his 30-day out clause.
So there was a 30-day out clause in the contract?
Yes, it is. He gave us a 30-day notice.
Well, if there's the out clause, then that would be the reason that I would.
It's
see as
due
maybe
to
not-
traffic concerns.
Yep.
That was the reason why he had a hard time responding within an hour.
All right, whatever.
Any further discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
The ninth item is a recommendation to cancel award to Victory Supply regarding bid number 2021-006. This is our annual contract for inmate hygiene supplies for the Sheriff's Office and Juvenile Services, and we're recommending awarding to the next low bidders per unit price. This contract does expire in 30 days. We've previously come to you within the last few months recommending other vendors that were having trouble with product, with some of the inmate supplies that comes from overseas.
Do you
So-
mind raising the mic some? I can't hear very well.
Sure.
Oh, that's better. Thank you.
And so our contract does not allow for price increases, so we have been allowing vendors to utilize the 30-day out clause for this particular contract.
So these are supply chain issues.
This one is, yes. But
Move
we have gone back
approval.
out to bid, and we'll be awarding a new contract next month.
Second.
We have a motion and a second. So on any of these other ones, are we basically letting them out and then I guess we just rebid it and hopefully we can rebid it in that 30 days?
Yeah, we've known about this issue with the inmate hygiene supplies for the last few months. So we do have secondary and alternate awards. So we've just moved on to the secondary and alternates. They were able to hold their prices because they had room to allow for increases.
Okay.
But in the future, most of the time, we're just rebidding.
Okay. Any further discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
And the 10th and last item is a rescind of court order number 136504 for award recommendation regarding bid number 2021-138. This is our annual contract for trash removal services. After the award was made, the buyer brought to my attention that the bid tab had a weekly charge and it should have been monthly. The spreadsheet was incorrect, so we made that correction to monthly. It read weekly.
Okay, so what are we gonna do here? We're gonna rescind this contract and,
We're rescinding the last, we bought this to court the last Tuesday we met in September, and that was under court order number 136504. So we're rescinding that one and asking for your approval of the
of a corrected.
the corrected contract.
Okay.
Yes.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you.
Thank you. Court members, are there any appointments today? I need to appoint Russell Laughlin to the Northern Trinity Groundwater Conservation District for another term ending 12/31/2023.
Second.
Move, or did you?
Let me add one to that motion, please.
Please.
I would like to add, Wayne Merritt to the NTGCD board. Reappointment.
He's not
Second
anybody
accepts
we
the
know of.
addition.
Hmm?
The second accepts the addition.
I don't know about this guy.
What board was that?
He's got a questionable son.
Well, yeah.
This is Chandler's father, and it's for the water.
Yeah, but you got rid of it, so you can't talk about him anymore.
I guess that's right. If there's no further discussion, please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Okay, you have before you the claims, including the addendum.
Move approval of the claims, including the addendum.
Second.
We have a motion and a second to approve the claims, including the addendum. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Hot dog, we got one briefing item left.
Yes. If we can go to the briefing item now, we're going to go into item 11D. This is concerns, I'm sorry, 11C. This concerns the IEM interim report. Ms. Camareno is here to address the court this time. Kristen, before you address the court on this, would you introduce some of our new employees at this time?
So we'd like to introduce to you a few employees in the administrator's office who will be working on ARPA and FRF with us. So, You'll become very familiar with them as you see them in the courtroom and working on programs and projects with us. So I'll ask them to go ahead and stand. Jason, go ahead and stand too so they can put a name with a face. So Jason Adams has been with us for a while now, and you receive a report from him weekly on Tuesday mornings. How long have you been with us? 6 months, 9 months? I can't remember. Okay. So, time flies when you're having fun. Deshaun Johnson is a new data analyst in our office, and Dr. Duchess Humphrey is our program evaluation specialist. So they'll really be into the weeds of the programs as we begin to roll things out under ARPA.
Great.
We'd like to welcome them too.
Now, Deshaun is not one of the ones you just shipped a budget.
No, those positions were vacant.
Oh, okay.
Yeah, no, we're not giving these two away. Okay. And so now to our briefing item. So you've each received a digital copy of the interim report that IEM has provided to us. You also have a print copy there with you. Commissioner Johnson will get a bound copy to you sometime this week.
I don't have one.
It's on your desk, sir. We can.
Okay.
Okay, GK's got one for you.
This? Okay.
Yes, sir.
So this
Okay.
is the same thing that's in the red folder, or?
Yes.
No.
No, this is the one that we emailed to them, and so
Yes.
is the slide deck, is that what's in the red folder?
The slide deck is in the red folder, yes. So IEM is here to present findings that are contained in that report. It looks like what's in your red folder are the slides that they will be presenting today.
Okay.
Yes. So with us are Katie McCoy, Angel Roebuck, and Meg Amento. You all met them during our consultant introduction meetings in August. Katie will be presenting today, and Meg is going to be in the back doing some interactive mapping for you. So I'll go ahead and ask Katie to come up.
Good afternoon. Thank you for having me back. So as Kristen mentioned, I'm here to present the findings for the interim report. So as we wrap up phase one, we are on the left-hand side, the end for the present the action plan to the court for consideration. Moving forward, we will be doing those focus group roundtables. We'll also be including some community representation as part of those, and then doing some surveys for the community as a whole through the months of October through December to compile all that and do our final report and list of recommendations by the end of January. So this is just a slide that shows what the front cover of the interim report is. But we, over the last 6 weeks, we've done about 40 interviews. We've talked to over 120 stakeholders, which is pretty substantial in 6 weeks. And then on the right-hand side of the slide, you'll see all of the organizations that we talked to one-on-one. And I'll give you guys a second to read through that, because that's a lot. And I don't know if I could read it from here anyway. So moving forward, we do want to continue to have that equity approach. So we're going to use data-driven priorities. And when we talk about data-driven, I'll show you in a couple of slides what that's going to look like for us and the information that we've compiled. We also want to continue to do community engagement with the county at large, and then evaluating the benefits versus the barriers. So what barriers do we need to remove to make sure everyone gets the most benefit out of the recommendations that we're addressing. So just a quick highlight for the Tarrant County profile, and this is kind of in order of what that report looks like. You'll see in 2010, it was about a 67-33% split, and then we are now a minority-majority county. But this is really the breakdown of what that looks like based off race and ethnicity. So we went from, sorry, did you have a question? It's okay. So for 2020, on the white side where it says 49%, about 29% is Hispanic or part of that 2 or more races. So we also developed an interactive map for the county to use, where we've compiled a list of data points. So it really includes the top quintile of the community resiliency estimates as well as the social vulnerability indices, the qualified census tracts, population density, median income, vaccination percentages. So we're using some data that we pulled from the county health department to include first dose and fully vaccinated individuals, race and ethnicity, as well as languages spoken. So I believe Meg can hear me in the back, and she's going to switch to the actual map. So this is a website that you guys will have a link to as well on the electronic copy, but we'll make sure we get you the link as a standalone as well. So when you first click into the map, it'll show you the overlay of the SVIs, the CREs, and the qualified census tracts. Uh-oh. I think she was trying to refresh it, and it maybe didn't work for us.
Yeah, I tried to access it straight from the electronic presentation. It's not working either.
It didn't work for you either?
No.
Okay. I know we had an issue earlier with maybe the browsers not working and not being a supported browser, but we'll find a way to work around that for y'all.
Oh, wait. Yay. Okay. Wait, it popped up. Okay. It worked in Firefox, but not
Not
one of the
Edge
other
or-
ones. Yeah,
okay.
yeah.
So would you like to just simply come back to that piece?
Yeah, we can come back to that. Okay, thank you. So moving on to the next piece, really the impacts of the pandemic. So I do want to preface this by saying, that the data that we're going to present for the pre-pandemic picture that we're painting will not have side-by-side comparisons for post-pandemic or currently, just because that data is currently being aggregated and may not be available to us. So you're going to see some data on the left-hand side that may not have a direct correlation on the right-hand side. But the areas that we wanted to focus on were for health and wellness, food insecurity, housing and homelessness, care of our aging population and people with disabilities, quality childcare and out-of-school care. I think they got it to work. Okay, we'll go back to this. So when you open it, it'll show you the overlay of the SVIs and the CREs. So I believe the SVIs are in blue, the CREs are in red, and then the yellow is an overlay of where both of those intersect. And then the green outlines are going to be your qualified census tracts. And Meg, if you can scroll in a little bit, zoom in for us a bit. There we go. On the left-hand side, okay, it's struggling. That's fine, we'll come back to it. Local businesses, workforce, and then community violence, and that's also going to include domestic and child abuse, as well as sexual violence. I'm not sure if the AV team can help me advance the slide. The clicker doesn't seem to be working. Thank you. For health and wellness pre-pandemic, we had about 20% of the county residents who were reporting being in poor or fair health. We also had about 22% of adults who were uninsured for the county. About 30% of the county was obese. And then 3.9 poor mental health days were being reported per month based off of this survey. And I believe this came from either JPS or Texas Health Resources. 12% of adults experienced frequent mental distress, which is about more than 14 days per month. And then we have one mental health provider for every 820 individuals, where the national average is about 1 to 290. So we're in a pretty dire state as far as mental health providers. On the right-hand side, you'll see some of the impacts that we've seen or that we've heard anecdotally over the last 6 weeks from the community members who we've spoken to. So we're seeing a disproportionate impact of COVID-19 frequency and severity among communities of color. We're also seeing a 50% increase for drug overdoses, for death, suicide becoming the leading cause of trauma deaths in the last 18 months, and then an increased need for mental and behavioral health services. I don't think any of this is any surprise for those of us in the county, but just some information to compare pre-COVID and then currently. We can go to the next slide. I'm still having a difficult time advancing on my own.
Are you using the
Yeah. I don't know if they clicked off of it.
Okay,
So
so
it's
go
not-
ahead and advance the next slide, please. So may I ask a question while we're, so one of the things that I don't see on here is access to healthcare. Is that going to be an issue that we talk about today?
We can, I don't believe it's included in this presentation, but that's definitely something we'd like to continue to have a conversation about.
You might notice that there was an article in the newspaper 2 days ago about the lack of individuals maintaining their appointments for cancer screening and the severity of what happens when you let cancer linger without treatment. And so I believe that eventually we're going to want to be talking about that also.
I understand that there are some interventions in the works that we should be hearing about shortly.
Yes. So moving on to food insecurity, pre-pandemic, we had about 25% of Tarrant County residents with limited access to grocery stores. We had 15% of the county who were experienced food insecurity and about 18% of children who were experiencing the same, with the overall average nationwide being a little less than 11%. So as far as the impacts from COVID-19, we saw increased food insecurity for older adults, and then our Tarrant Area Food Bank as well as Meals on Wheels saw a significant increase. One of the things that's a positive that's come out of COVID, but due to increased federal support, we've actually seen a decrease of about 30% in homelessness for the county, which is huge. But we do still have a pretty significant lack of housing and rental inventory, and then lack of non-acute housing post-COVID for the aging population. It's also a very competitive home buyer market, and we have some insufficient and inaccessible legal support for those facing eviction.
So before we move forward, may we stand down for about 5 minutes? We need to reboot our system so we can get this slide program.
Is that because IT decided they were gonna do a software change in the middle of the day?
No, sir.
Just wondered, because about 2 or 3 times I've had to click today to tell it, don't you dare close me down right now.
So you.
Yes, we can stand down for 5 minutes.
Thank you.
Okay.
Okay, we're ready to proceed.
Apologies for that.
Good luck.
Not
Thank
your
you.
fault, Katie. Not your fault at all.
I told Kristen, I said, I used to work government, so I understand the IT challenges. This is something that's easily overcome, so.
Yes.
So going on to the next focus area for care for aging adults and people with disabilities. Pre-pandemic, we had about 11% of the county population that was over the age of 65, and then 33% of the residents who were 65 plus, who also had a disability. So that's a pretty significant portion of our population. And then during COVID, what we really saw was that increased isolation, depression, and associated cognitive decline of aging adults. We also saw higher risk of injury for those living alone. We saw increased symptoms from chronic diseases in older adults, caregiver staff shortages, so not just caregivers, but also people who worked in nursing homes who changed the linens, who did the janitorial piece of it too. We saw significant decline in those numbers. And then we also have a projected 25% growth with the county for population over the age of 65 in the next few years. The next focus area is quality childcare and out-of-school care. So prior to the pandemic, about 1 in 10 Texas children under the age of 5 with working parents live in a childcare desert. That's pretty significant. And then we see an average cost of $7,500 to $9,500 a year for full-time childcare just within Tarrant County. Some of the impacts from COVID-19 were the academic delays compounded by social emotional delays for children, and that was due to either online learning for lack of socialization with kids their own age. But then we also saw a lack of availability and access to high-quality childcare and youth services. So that already desolate area experienced even more lack of availability. We saw high turnover, low pay, and a need for training and certifications for providers, and then long wait lists for after-school care. Our next focus area was local businesses. So pre-pandemic, we had a little over 43,000 establishments, and then about 173,000 total firms. So a little over 66,000 women-owned, 71,000 minority-owned, and then 16,000 veteran-owned. Impacts from COVID, this is no surprise, lost revenue, small business closures, significant job losses, and disproportionate impact on women and minority-owned businesses. And then for workforce, prior to the pandemic, almost 75% of the employees in Tarrant County worked for a private company. Not quite 3% were self-employed. A little over 5.5% were private not-for-profit and salary workers. By August 2019, we had a 3.4% unemployment rate, which is relatively low. Because of COVID, we saw almost a 6.5% unemployment rate in August of last year, and that's gone down to 4.9% unemployment as of August of this year. In June 2020, we had a record 33% of U.S. employees who were working remotely. And then that's gone down a little bit to about 22% as of last September. And it's stayed pretty consistent since then. We also saw an increased need for job training and job placement, and then challenges in skills matching between workers who are available to work and then the available jobs that are out there. And then we also saw an increase in competitive wages due to the lack of people available to work. Moving to community violence. Pre-pandemic, 1 in 3 women in Tarrant County will experience domestic violence at some point in their lifetime compared to the national average of 1 in 4. 8 Tarrant County women were murdered by their current or former intimate partner in 2019. Almost 14,000 family violence incidents occurred in 2017 in Tarrant County. And then we had 132 homicides in 2019, of which 95 were gun violence. From COVID, that number for intimate partner murders almost doubled, or more than doubled, was 17 during 2020. We saw an increase in homicides, specifically gun violence. We saw a 25% increase for the need for forensic rape exam accompaniments going up to 89 a month. I believe the former number was 71 a month. We saw a 15% increase in child forensic interviews that were being conducted, a significant increase in children witnessing violent crimes, a 26% increase in response to severe child physical abuse, and then shortage of staff, including caseworkers and volunteers, to help support those efforts. So, with all of that information, our initial recommendations. These are our near-term recommendations and long-term priorities, and these will be aligned to those 4 focus areas that the county identified prior to us coming on. So, just an overview. This is just the main slide with all the 4 focus areas and then the goals associated. So, for Prepare for the Future, for near-term recommendations, we have expand Tarrant County staffing capacity, evaluate use of current Tarrant County space, review county response to COVID-19 for lessons learned and best practices, and then improve air quality in Tarrant County facilities. For long-term prioritization, we're engaging with community-based organizations supporting underserved populations, develop a community affairs program to support equitable messaging of available programs, and then streamline the Tarrant County's application processes to improve accessibility to services. So that's it for Prepare for the Future. For improved public health and wellness, for near-term recommendations, we're recommending a mental health awareness and early intervention program for school-aged children, enhancing preventative cancer screening programs within targeted communities, restore the assisted outpatient treatment program, support service navigation programs for at-risk families with children aged 0 to 18, expand mobile and pop-up vaccine clinics in underserved communities, and support health fairs within targeted communities, and then establish a personal protective equipment program. Long-term priorities for improved public health and wellness will focus on collaboration with law enforcement to meet the mental health need for those with behavioral health issues, calling emergency services, and connect them with the available resources that they'll need. And then develop a mental health diversion center to accommodate the needs of individuals needing mental health assistance in place of incarceration. For Revitalize the Economy, near-term recommendations: direct grants to businesses and nonprofits within affected sectors and/or located in qualified census tracts. Expand technical assistance and entrepreneurship training to women and minority-owned businesses, as well as historically utilized underutilized businesses, And then expand family and support programs to those with dependents with disabilities. For long-term priorities under Revitalize the Economy, partner with college and workforce readiness programs to expand preparation efforts for Tarrant County youth, expand equitable access to high-quality early learning and care for all Tarrant County families, support incubators and accelerator programs to support innovation, and then encourage creation of apprenticeship programs for graduates of technical training schools. Under Strengthen the Community, for near-term recommendations, we're recommending direct programs to expand evidence-based abuse and violence prevention programs, direct grants to nonprofit organizations providing essential services and support to low-income aging citizens, direct grants to expand food distribution, continue to manage the emergency rental assistance program, and then provide financial assistance and legal support to people facing eviction or homelessness. And then finally, the long-term priorities for Strengthen the Community is to direct funding to support building and/or renovation of additional units to house people experiencing housing insecurity or homelessness in qualified census tracts, and then expand programs to increase financial literacy and promote financial stability. Any questions or comments on our recommendations?
I think you've done a good job.
Thank you, sir. I hope we met your expectations.
You're good, man.
Okay.
I agree. I do have a few questions, though. One is, some of the data points that you provided, they're sourced, but most of them aren't. So can you, I don't know, hopefully this is all footnoted somewhere. I'd love to just, as I'm sharing it, I want to make sure that I'm attributing it correctly, and also will want to do some more research on my own.
Yeah, of course. So I forgot to mention, in the back of the actual printed document that you
Okay.
have, there are a couple of appendices. So the first appendices is going to be the full recommendations list. So it's going to tie each of the recommendations I just went through to a specific focus area and goal. It's also going to crosswalk it with any available program that's currently in Tarrant County that we found.
Okay.
And then additional funding sources.
Okay.
One of the other appendices is going to be the resource assessment. So all of the other grant programs that are out there under ARPA, not just FRF. And then other things that include HUD and a number of other financial resources that are available for the county level.
Okay.
There's also a reference portion of this that has all of the sources that we used.
Perfect. Okay, great. Well, and I'm really glad to see all the maps that are in here, specifically about languages spoken. And we had this conversation in the context of the redistricting is really problematic if people can't even see themselves on a map. So as far down as we need to drill to make those numbers apparent on a map, I want us to do that like in every instance, so that people are seen.
Yeah, that was one of the things that I had hoped we would have been able to do today with the map, because you can see multiple layers. The maps in the back are great. They're all brightly colored, and you can see specific layouts, but being able to layer those on top of each other to really dig down into what you're looking for, I think would be really beneficial. So, yeah.
Off the top of your head, when you were referencing access to food, what's the current definition of a grocery store? Because that changes, and that's a big difference. That can make a big difference.
That is a really good question. I do not have that off the top of my head, but we can go back and pull that for you.
Okay. And then I know that we had all provided lists of community organizations, community leaders that we wanted for you all to reach out to. And obviously you had to, kind of triage that list and see what was appropriate to get us to this point and moving forward. But so what's the expectation that we should give to the people who were on those lists but have not yet been contacted?
Well, we're in the process of reaching out to them for community roundtables. So if they're either going to be part of our equity and inclusion group to give us or validate some of the approaches that we're going to be taking, or give their input, they'll be contacted for that, or they'll be included as part of a specific focus area. So we're going to take a couple of these and dig down into to get a little bit more information that we may not have yet.
Yeah. I will add, all of this information is good, and none of it necessarily surprised me. I don't know if that's good or bad, right? Yeah. Especially some of these statistics are pretty sobering. But when we talk about the access to mental health specifically for our youth and young adults, obviously just 2 weeks ago we suffered the tragedy at Timberview. I have been on the phone, can't even say how many conversations I've had, and been a part of virtual events and where the community has just talked about their sadness and their fear and their grief and the trauma. So hopefully there won't be another such tragedy, but obviously the last year and a half has showed us that our community has just gone through so much. So I just want to impress upon us all how important it is specifically that we are caring for the children in our community. So, yeah.
Thank you for that. So as I mentioned, we're now about halfway through phase 2. We're going to start, we're focusing, I believe, the first week of November for the community roundtables. We're reaching out to people this week to invite them to those. And we've identified a few groups who we'd like to speak at those and kind of give, some of them have presented here, but then some others have not. And then we'll be able to compile that information on top of what we've already done as well as the surveys that we'll submit out into the community, hopefully with the support of all of you, to help distribute that and get a little bit more information from the community at large. So our next steps, we're going to continue that outreach and engagement through the roundtables and surveys, continue focusing on equity, so really making sure that we're putting those who with the greatest need at the forefront of this project, continuing that regional collaboration. One of the things that I've been very impressed with, and I think my colleagues would say the same thing, is that every person we've talked to has said, we just want to support each other and make sure that this is the best option for the entire county. There hasn't been a lot of ego involved in it, which is really great. And then continue that strategy development in partnership with the county administration's office. So making sure that we're producing strategies or recommendations that fit appropriately for Tarrant County. So I did want to mention something about the interactive roundtables. We use a platform called Mentimeter. It's probably the only time that we encourage people to take their cell phones out whenever we're in a meeting. So Commissioner Allen, I think you saw a little bit of that with the Latino Leaders group that we talked to. So this is actually a result of one of their questions. So they'll be given a website and a unique code for that particular roundtable. We'll ask them a series of questions, and it'll be anything from, on a scale of 1 to 5, an open-ended question so they can put in a couple of words that would best describe their response, or a list of items that they can click off that'll go into a database. So this is just a screenshot of what that looks like for us on the back end.
Is this still called a Wordle? Is that what this is?
I'm sorry?
A Wordle? Is this still called a Wordle?
I think we call it a word cloud. Yeah.
Thank you for updating me.
But Wordle is a little bit more fun to say.
Right, it is. Thank you.
That is all I have today. Thank you very much for your time, and I'll open it up for any questions from us.
In the course of your conversations and your interviews, especially with other recipients of this money, you know, we've talked about it in terms of maybe setting some countywide priorities with other entities, putting money in a pot and then distributing it. We've talked about, you know, I mentioned tithing and doing things along that lines. Has anyone else expressed any interest whatsoever in doing something along that line?
So we are also planning to do an electeds roundtable in December with the cities within the county, and that is going to be part of that conversation. So no explicit interest has been expressed so far, but that's something that we're keeping as part of the conversation as well.
I still hope that that's one of the things that we might be able to do, because I think the things that you've mentioned, homelessness, mental health, things along that lines, especially education, childcare, quality childcare, after-school programs are things that are going to help our kids catch up on the education standpoint, as well as with the health and some of those kind of things. And instead of each one of us trying to do our thing in those areas, I hope that we could pool some funds, pick the partner that could best, you know, execute those priorities and move forward with that. Any other questions, comments at this point in time?
Okay. Thank you all so much.
Thank you, Katie.
Thank you.
So you've heard the next steps for IEM. I'm just going to briefly try to tie that into our internal processes and provide some next steps from staff. So we will, on the long-term program development, we'll continue to coordinate with IEM for phase 2 of their assessment, and of course work with them to keep the court updated on that. But for the near-term recommendations, we'll go back and develop a program outline that corresponds with the recommendations you've heard today. So what that means is reaching out to those stakeholders, requesting solutions to meet the needs that have been identified, and formulating program recommendations that tie back to our focus areas and providing an overview of what the fiscal impact might be to our FRF fund to implement some of the programs to meet the needs you've heard today. So that's a lot of words to say that in the next couple of weeks, we'll be coming back with some dollar amounts and some requests for action to move forward on some of these items. Any questions?
Questions?
Okay, thank you.
Okay, it's been a day, and thank y'all. Yes, ma'am.
Can I ask that we adjourn in honor of Colin Powell?
I think that's a great idea. If that's okay, then we will do that. And with that, we stand adjourned. Thank you.